Occasionally, tumor location is involved in eloquent areas of the brain, and by eloquent areas, especially of the cortex, which is the surface of the brain, we mean areas that have very critical functions to how a patient is able to interact with other people and move. So parts of the brain that control the hand or the face or the leg certainly are eloquent areas. More importantly, are areas that either understand or produce speech. So when tumors are near or even in these locations, the anatomy of the brain is not fixed. There's no clear map that shows us exactly where these functions reside in the brain. As such, we need to do a functional mapping of the patient's brain. We do this by waking them up in surgery. This is called awake brain surgery. After the craniotomy has been performed and the brain surface is exposed, the patient is awoken from anesthesia. They don't feel pain, they don't feel discomfort. It can be a little bit unnerving at first, but most patients really enjoy and certainly want to take the opportunity to participate in their own surgery when it means helping to maintain these vital functions. We stimulate or deactivate different areas of the cortex while the patient is performing certain tasks that are generally in the location of where the tumor resection is going to have to be. So for example, we'll have them name objects or talk to us about different subjects. We'll have them move their hand or face, whatever part of the anatomy may be involved in that location of the brain. By deactivating a small area of the cortex in surgery, we can see how that affects the patient. If it doesn't affect them throughout those vital and critical functions, then we know generally resecting that area is going to be safe for them. This is not a foolproof way to ensure that they're going to wake up from surgery without any deficits, but it certainly is the safest way that is currently available to neurosurgeons. This is a technique that really is only used by a handful of centers and a handful of neurosurgeons in the country, and only applies to a subset of brain tumors. But when it does apply, it is critically important that patients understand where tumors are and how it can affect them, both in terms of a temporary or even a permanent serious neurologic deficit.